Okay, good afternoon everyone, and welcome to our SeeSay online reporting program. This is your space where we'll talk about civic matters, be it human rights, be it rule of law, be it governance issues, whatever it is. Okay, this is that space we talk about it. So today on our online SeeSay radio program, we're talking about your health insurance and employee rights. Health insurance and employee rights. First off, do we actually know what health insurance is all about? Do you know about health insurance? Have you heard about health insurance? Okay. Do you know your rights as an employee to health insurance? So these are what we are going to be discussing on our SeeSay online reporting program today. So if you've heard about health insurance before, you can go ahead and tell us, oh yes, I've heard about health insurance. If you use health insurance, you can tell us, yes, I use health insurance. If you know nothing about health insurance and you are an employee, like you have an employer, you have someone you're working for, and yet you've not heard about health insurance, they've never talked to you about health insurance, this is also a platform you have to tell us, okay, oh, see, I work for this person, but I don't know anything about health insurance. Can you elaborate more? Can you tell us what it means? Can you do this and do that for us? Then we'll take it up from there. So to start with, health insurance is a right you have as a citizen of the Federal Republic of Nigeria. So the Nigerian government before now actually saw the need for its citizens, okay, to actually get access to healthcare, quality healthcare. They decided to start from the primary level. That is why in communities, when you go to most communities in Nigeria, they have the primary healthcare centers. Okay, those ones are the ones that the grassroots will always have access to. When you go to your community, there is no community in Nigeria that doesn't have a primary healthcare center. But the only thing we Nigerians are always clamoring for, advocating for, is to better the structural and the system of these primary healthcare centers. That's the only challenge we have. But do we have primary healthcare centers? Yes, we have. And this is a means, okay? This is the means the government was actually used to reduce the risk or lack of access to quality healthcare in rural communities. But after, apart from getting primary healthcare centers set up and the rest of them, they also did something that is very nice, which we all need to know about. But it's really fun. I wouldn't say funny. It's really disheartening that so many Nigerians don't know their right to health insurance. More especially those that are working. You're a worker. You work in anywhere, a private sector, a public sector, but you don't know your rights to health insurance. You don't even know what health insurance is. Talk more of knowing that you have that right. So we're going to be talking about that today. So you just have to stay with us so that you can grab everything you need to know about health insurance and quality health care based on employer and employee level. So in Nigeria today, many people still pay directly for health care, okay? And that can be very expensive. One hospital visit can wipe out your savings. That's just the truth. And that is why health insurance is not just a benefit, it's protection. Health insurance helps you to access care early. With health insurance, you avoid financial stress. With health insurance, you protect your family. For example, just imagine that there is an emergency in a family, and that family don't have health insurance. That same family doesn't have any money to take their loved one or whoever it is that is sick to the hospital. What do you think will be the fate of that particular person? We all know the answer to that. So some of the deaths that are being recorded in Nigeria, some of the mortality rate that is being recorded in Nigeria is not as a result of, okay, yes, God wants this person to go home. But that's the mentality many of us have. When someone dies, we will say, oh, yes, God wants this person to go home. But there are some things that would have been put in place that would have made that person live longer than they did. That would have made that person still be alive till today. But those things were not put in place. And one of those things that you can put in place to ensure quality health care is health insurance. So when we talk about health insurance, it's not something that everybody should shy away from or say, I don't have money. And another mentality Nigerians have is that health insurance is for big people. Okay, the billionaires, the big men, they are the ones that should, go with health insurance. It's not for us. But that's not true. Health insurance is a provision that was made for all Nigerians by the Nigerian government. That is why we have some acts. It's actually an act, it's a law, and it's binding in Nigeria. So when you come to the 1999 Constitution of Nigeria, the government is expected to ensure that the health and welfare of citizens are, intact. That is one responsibility that the 1999 Constitution gave to the government. So be it at federal level, be it at state level, they have the responsibility of taking care of the health and welfare of their citizens. So because they know of this responsibility, they also, in their own, manner or way, looked for a way to make this thing easier for them, so that they wouldn't carry the burden of every Nigerian's healthcare on their shoulder. They decided to make avenues and make provisions that can make us, do what we need to do, get quality healthcare without always coming to the door of the government to knock and to disturb them. And then they came with what we know today as the National Health Insurance Authority Act of 2022. I don't know if you heard about NHIA. That is the National Health Insurance Authority Act of 2022. And what does this act say? So because it's an act, it's binding. So you can actually use this act to, sue someone, and you quote the act, and then, I don't know if you understand, just the way you go to court and then you use the law. The law says in section this and section that. The National Health Insurance Act is binding. Every Nigerian obeys what is in this act. And one of the provisions of this act is that health insurance is mandatory for all Nigerians. Health insurance is not an option. They are not begging you. They are not saying, please, so come and do your health insurance. They are mandating it. It's a mandatory, act that every Nigerian must be insured under the Health Insurance Authority scheme. Okay? So another thing we need to know is that employers are expected to enroll their employees in a health insurance scheme. Employers are expected to enroll their employees in a health insurance scheme. So for instance, if you're working, be it in a hotel, in an organization, whatever sector they belong to, and you are not enjoying health insurance, it is wrong. You have that right. So if you're working, your employer is expected to pay a particular amount to cover your health insurance. Your employer is expected to make a particular contribution to cover your health insurance while you take care of the rest. Yes, it is a right, not like, but many people don't know this, okay? Then you go to work, you don't have any health insurance, your employer is not paying anything for your health insurance, and then, you think that's how it should be, but you don't know that you're being deprived of your rights. Another thing we need to know is that employers must contribute to workers' healthcare coverage. It is your right for your employer to contribute to your healthcare services or coverage. And the goal for this particular health insurance is to make universal health coverage accessible to all. Everyone should have access to healthcare without financial hardship. So let's actually break down how health insurance works. Let's break down how health insurance works. For instance, if you are insured, you have a health insurance scheme that is covering you and your family. Now, when you are sick, you go to the hospital, Abby. When you go to the hospital bill after everything might be 100,000, for instance. But because you are under health insurance, or because insurance is actually covering you, your out-of-pocket payment for that particular treatment or whatever it is you did in the hospital might not be up to that 100,000. You might be paying a 50,000 or a 30,000 out of the 100,000 you actually. Why? Because you are insured. So meaning that government is paying some percentage for you, and then you are covering the other costs. Now, to also make it easier for Nigerians, government now said we are not the only ones that will pay percentage for you while you cover the rest. If you are working, your employer should also cover some costs for your health insurance. I don't know if you understand. So if you have not, when you go to some organizations, their workers are not registered under health insurance, their employers don't make any contribution to their health insurance, and they don't even inform their employees about their rights. So many people are working, but they don't know that they have the right to health insurance. And because people don't know about this, they don't ask questions, they don't check their contacts, and they don't do anything. So for you to be able to know whether in your organization or wherever you are working, your employer actually listed health insurance as one of your benefits, I think you should just go back to your employment contract or ask your HR or anything to know about your health insurance. So many people are asking questions: how employer contributes, how does the contribution work, how many percent contribution would they make, and the rest of them. So this is what we are going to be talking about now, okay, to let you understand very well what your right to health insurance is all about. Okay, before I forge ahead, in our organization we actually have the C-Health, should I say, program area that takes care of these things. So you can actually check the link. You can actually check the link on the comment section. I'm going to drop it later after this video, so that you can reach out to the health officer to know more about the health insurance and how it works. But if you are an employee, you're working for someone and you don't have access to health insurance and you want to know more about that, please drop your comments or drop your questions. You can reach us out via WhatsApp on 081 6507 07214. 08165077214. We're going to be reading out your questions and be answering your questions on health insurance. No. Somebody is asking if health insurance is meant for everyone. Yes, health insurance is for everyone. I think I actually stated that when I started. Health insurance, this is the mentality people have. I've heard someone say that it's my madam has health insurance, but me, I don't have. Now people will get money now, they get health insurance. That's not true. That's a lie. That's fallacy. You have the right to health insurance. It is mandatory. When the government use the word mandatory, you should know what it means. It means that it is compulsory. And for them to be able to achieve this, that was why they now told employers to, contribute a particular percentage towards their employees' health insurance. So if you're not even covered, if you're not using health insurance, you are wrong. Yes, you are wrong, and you're depriving yourself of that right that government has given to you. You see so many people, when any little thing, cough, they are going to the hospital. Catarrh, they are going to the hospital. Headache, they are going to the hospital. But you'll be in your house, serious sickness, serious fever, you are still in the house. Those who are going to the hospital, you feel that's because they have all the money in the world. That's not true. Most of them, health insurance is covering them. Because they know they have health insurance, they will always, want to utilize the health insurance. So any little health challenge, instead of giving themselves self-medications or trying to sort out themselves, they go to the hospital for proper checkup and health care. Okay, so health insurance is for everyone. Just like I said, I will send you the link. I will drop the link so that everyone can actually have access to the C-Health healthcare, and then they will tell you more about, in case if you want to register for health insurance or you have people you want to register for health insurance, they will tell you more about how it works. Okay, yes, about how health insurance works. So please drop your questions. I'm going to be reading them out and be answering anything you think is bothering you when it comes to health insurance. Just let us know. Okay, someone is asking, do you want to know how to approach your employer about your health insurance? So just like I mentioned earlier, you will check the contract you signed with your employer before now. Was there any provision for health insurance? If there was no provision for health insurance and you already signed, you're already working, you've been there for years and nothing like health insurance, I think let's just take it that your employer is ignorant, but no employer should be. But let's just assume that your employer is ignorant of this right you have, your right to health insurance. So as you've heard this thing today and then you have a better understanding of how these things work or how it works, just go back to your employer and then let them know about your right to health insurance. Just chip in, a talk Like, sir, I want to know, I was listening to something, you know, some days back, and then I was hearing about health insurance, that employers should, you know, contribute some percentage for employees' health insurance. So I don't know if you know about this. How does it work? Let's hear their view. Just get to know what they want to say. I wouldn't advise you to just go and say, I've been working here for 2 years now, this man has not given me health insurance, and then you want to go and sue them, or you want to cause trouble. So let's take it amicably. Just ask them, do you know about this health insurance, sir? Do you know that employers actually have some percentage of you know, contribution they should make to the employees' health insurance? Then hear him out. He might say, yes, I know. Then you can further the question by asking, why are we not getting health insurance in this our organization? Why are we not covered? If they say no, then you educate them the more and tell them that this is it, this is how it works, sir. There's something like the national you know, what do you call it, NHIA, National Health Insurance Authority Act of 2022, where I have this right and I have that right. You can actually educate them. Because of you in that organization, they can actually start this health insurance talk and then take it up from there. So many should I say organizations, so many companies are ignorant of this. Why some are not ignorant? But because they know their employees are ignorant, they keep quiet. Because they will not want to make that contribution, and they know if you are not asking any question, if you are keeping quiet, they will kukuma keep quiet, and that percentage will be going into their purse. Meanwhile, it is your right. So just the way they will demand you to work hard, they will demand you to make money for them, they will demand you to go the extra mile to do things. That is also the way you have the right to demand for things that you know are your rights. But just like I said earlier, most Nigerians are ignorant of these things. They don't know, and some don't even care to know. I know of people you will talk about, you will tell them about health insurance, they will tell you, I beg, leave that thing. For me to go and spend money, I don't have that kind of money to spend. They don't even want to sit down and understand the benefits. They don't want to sit down and understand what you're talking to them about and how it's going to benefit them. They'll just tell you, I don't have that money. And health insurance is not even expensive. It's really not expensive compared to you going to the hospital on a regular and spending your own money. So it actually helps you cut costs of buying drugs, treatments, and all of that. And there are so many packages. I think when you go to a C Health Center, you will learn more about health insurance. But I'm here to tell you about your right to health insurance and your right to demand for this from your employer. So if you're working, be you a sales girl in a shop, whatever shop it is, Best Niger shop, anywhere it is, in a fuel station, anywhere you are. You're working in a corporate organization, you're working anywhere, as far as you have someone who pays you every month, you're working for the person pays you every month, you have the right to demand for their contribution towards your health insurance. So health insurance is for everyone, and you can demand for that. For the person that asks, how do you approach? I've told you how to approach. Just go to them, you know, speak to them politely about it to know if they really know about this thing before you now go ahead to, you know, talk about it, make trouble if they really, not really making trouble, but demanding for your rights and doing the right things. When it gets to that point, we'll tell you the legal steps to take to make sure that your rights is effected. Okay, keep your questions coming. The numbers to reach out to, not call, but the numbers to reach out to via WhatsApp, 081 65 04 7214. Okay. Okay, for the person that is asking for the percentage, how health insurance works, the percentage employers should pay and employees should pay, okay, for health insurance. Now, this is how it works. Your employer should actually pay 75%, while you are to pay 25% of your health insurance. For instance, if health insurance, let's say for a year to cover, but it's not up to them, I'm just assuming, it's 100,000. You need to pay 100,000 naira for health insurance in a year. Now, it is the work of your employer, the person that is paying you salary, to pay 75% of that 100,000 for you to get your health insurance, while you pay the remaining. Although so many people actually go about, talk about health insurance and they do health insurance, but they don't follow this particular percentage. They do the percentage that best suits them. or the way they feel it works for them. But according to the NHIA Act of 2022, this is how it's supposed to be. Employer 75%, employee 25%. So meaning if health insurance is 100,000 naira a year, your employer should pay 75,000 naira and you will pay 25,000 naira. So some of them deduct it from your salary. Okay, they take it from your salary on a monthly basis or however you guys discussed it to be able to cover up. But you can see that in some places, reverse is the case. The employees pay the highest percentage while the employers pay the lower percentage. No, that's not how it's supposed to be. The employers are to pay the higher percentage while the employees pay the lower percentage. So this is government's way of making sure that healthcare is accessible to everyone. So if you are working in a place where you earn 30,000 naira a month, your employer, and then maybe health insurance is 100,000, your employer should bring 75,000 naira. You are to bring 25,000 naira to make up for your health insurance. But some don't take it outrightly. I don't know if you understand. They don't take it like should I say 75 in a month. So they now break it down. You understand? For some organizations, I'm just saying, some organizations will decide to be taking 5%. Some will decide to be taking 8% on a monthly basis till they get to that 75 or that 25 for a year. So this 75% I'm talking about and 25 is a year plan. Do you understand? So but others know the way they do it to make sure that it works well for them. But that is it. So for the person asking for the percentage, it is 75% against 25% for your health insurance. Okay, someone is asking me to compare Nigerians NHIA versus private corporate plans. I think this particular one will be a topic for another day because I wouldn't say I have a very broad understanding of the private corporate plans. So I will actually look into it. All you just have to do is to drop your number, if you can. Drop your number for us and then I will get back to you on that. I don't know why you want us to compare the two of them, whether this other one is better off than NHIA or something, I don't know, but I need to make my investigations and get back to you on that. Private corporate plans. Okay, yeah. So I can see someone telling me 80% for individual, 65% for clinical. I really don't know which country you're using as benchmark or anything, but I'm telling you the way it works. And somebody else is saying 50% to 100%, then 0 to 50%. That it depends. It depends. I'm telling you, it depends. But what the National Health Insurance covers is 75 against 25. But you can go to a company that feels that they can cover everything. There are some organizations that they cover everything. You're not paying anything for your health insurance. You understand? So some of them even have hospitals that they have a particular hospital that staff go to. So when you're sick, you just carry yourself and go there and all of that. So I don't know for that, but I'm talking about using the NHIA Act of 2022. So your argument might be very, very valid, but I'm not talking based on your argument. I'm talking based on, you know. Okay, if you're just joining us, welcome to our online SeeSay radio, not really radio, our online SeeSay program, reporting program, where we talk about things that really matter to us. So today we decided to bring to you your right to health insurance. Just like we said, the Nigerian government before now, because health insurance was not done today, it's been there. So, but before now, they saw the need for health insurance to be something that will be approved and be made to be a binding law or order in Nigeria. So that was why they now have the health National Health Insurance Agency, Authority Act of 2022. So I urge you to actually go online if you have your time, download this act, read it very well, and know what it entails. Okay, know what your rights are, know what your obligations are as a citizen of the Federal Republic of Nigeria. So there are so many rights that workers are not utilizing. Remember, I said this is the month of May, is actually Workers' Month. So we are going to be exposing so many things to workers to help them know what their right is and fight for it. Last week we talked about fair wage, and today we decided to talk about health insurance. So as a worker in a bar, you work in a bar, you work in a restaurant, you work in a supermarket, you work in a fuel station, you have the right to health insurance. You have the right to health insurance. And your health insurance shouldn't be deducted fully from your salary. Your employer should make a contribution, some percentage contribution towards your health insurance, and you also should make some contribution. This is government's way of saying we want everyone to have access to quality and good health. So know this today, even if you don't want to utilize it, but know that there is something called health insurance. Sometimes the Nigerian government actually did some things in favor of the citizens. There are so many things. One of the problems we have in Nigeria is implementation. If it's for the laws and the acts and the principles and the policies, we have them. But to implement these things is where the problem is. For instance, this health insurance, how many people even know about employer and employee health insurance percentage contribution? They don't know. And there are no avenues. The government is not actually creating a means to make the people know, to sensitize the people, to create awareness, let people know about this, their rights, and fight for it. No. So the laws are there. It's just for those that know. If you know your rights, then go ahead and fight for it. But if you don't know, talk. Your employer is winning and eating. I don't know if you understand. So Nigeria is a place where you need to know your rights. So you need to do your research, you need to ask questions, and when things like this come up, you pick it up, and then you can from there ask questions and know properly what is your rights based on these things. So you have the right to health insurance if you are working. It makes it easier for you to get health insurance. So you cannot be working and then you are sick, you go to the hospital, they will tell you that the bill is 200,000 and you pay out of your pocket to pay that 200,000. It's wrong. But if you have health insurance, if you're working and you have health insurance, it will actually help you offset some bills, and then you just pay some percentage. So that money you're supposed to use and invest in that particular sickness or hospital bill, you can use it for something else. That's the good thing about health insurance. Just like I said, if you want to know more about health insurance, visit our C-Health website or check out for our C-Health social media platform. Contact the person that is in charge and know more about that. So we are going to continue this conversation on Wednesday by 2 p.m. on our SeeSay radio reporting program. This is the SeeSay online reporting program, and we have the SeeSay radio reporting program. So if you have questions, more questions you want to ask about this particular health insurance and employer and employee percentage, do well to reach out to us now on the WhatsApp line, so that on Wednesday we can read out your comments, read out your questions, and give you answers. Okay? Yeah, because our time is already fast spent here. This is where we're going to call it a wrap on today's episode of the SeeSay online reporting program. I'll drop the link to the C-Health website on the comment section. You go there, check it out, and make the inquiries you need to make. I appreciate everyone who actually asked questions and sent messages. I see you all. So many of these people that are actually dropping messages are working, but they feel no, it's not my right. My madam, this is our business. We are just selling what do you call it, puff and popcorn and guinea. Is it where they will give me health insurance? Ignorance is really not an excuse in Nigeria, and so many things are going bad because we Nigerians are ignorant. We don't want to fight for it. We don't want to demand for it, and then it stays there. But when you know what is yours and you fight for it, definitely you're going to get it. Join us on Wednesday by 2 p.m. We're going to also go live, so you're going to be watching us here while hearing us on air. Thank you for joining today's episode. We really appreciate it. See you next week, Monday. Bye.